You've got a new book, The Hiatal Hernia Syndrome. It sounds like your clinics are helping a lot of people. What's your story? How did you get to this point?
That's a good question. It started when I was pretty young. By age 10, I knew I wanted to be a doctor. I wanted to be a pediatrician. I loved children. I was pre-med all through college. I had a friend who was ahead of me. He was already in medical school. He was in residency. And I thought, I really want to immerse myself in this and really experience it. So one weekend I flew to Arizona and he was on call for the whole weekend, which starts Friday night and it ends on Sunday. And so got in my scrubs and followed him around. And Saturday night, a nurse woke us up in the middle of the night and just said, you have to come see this patient. And this gentleman was sitting up in bed. He was gasping for air. His eyes were bulging out of his head. He had what's called congestive heart failure. So his heart was failing and he was basically drowning in fluids. So my friend gave him a very strong diuretic to pull the water out of his body. We checked on him several hours later, and he was talking. He was up. He was talking, and so we went back into the hallway. And my friend was like, high five. This guy survived, and that was his goal on the weekend, was that nobody would die on the weekend on his watch. And so there was this moment of euphoria of great, he of course saved him. But for me, what happened was there was the euphoria followed by, I got pretty depressed because I realized, as great as it was that this intervention had helped this individual and he was alive this morning, he was never going to get his life back. His problem was so far gone that it couldn't be remedied. He would never be really probably able to leave the hospital even. And so I got pretty depressed because I'd always wanted to be a doctor and this wasn't what I had in mind. And so I thought, is there something we can do? Is there a way to intervene so much sooner? Sorry.
It's okay. These things are not easy to talk about.
Yeah, I always get a little emotional just because it was that moment of, oh my gosh, I've always wanted to do this. I've held doctors up as, I couldn't think of anything more rewarding to do in life. And then I was confronted with, this isn't it. So what is it? And of course, at the time, it was more just this huge problem of, I don't know what to do, but that got me going on this discovery of who does see patients earlier. What is that intervention? At what point in people's health can you really resolve issues and develop root cause medicine over several years? And so glad, so happy with that discovery.